asking what I wish I knew about my loved one before he died would have been, what were his real wishes? We had done living wills and advance directives many, many years before, but never dreamed that my husband would get a glioblastoma brain tumor and be dying at 59. And there was a lot of strife in the family. He had a child from another marriage. So I think if we had been able to have those conversations and talk about choice, talk about options, how far he wanted to go, because the 8 months he lived after his diagnosis could have been better for everyone involved, and most definitely better for him. So I wish that we had had the opportunity to have more in-depth discussions about how he wanted to die well, and dying well is possible. What I want my family to know about my wishes is that I do not want extraordinary measures when they would be futile. And after my 9 years in hospice and now being an end-of-life doula, when I bring it up, they throw up their hands and they're like, Mom, we know. But I see so much every day where families think they know and they don't. And I have put my wishes in writing. I discuss them freely and openly with friends and family. I will use examples that I come across in the work that I do and how sad a lot of these circumstances are. And knowing that the one who's dying most of the time has accepted that and is ready to go, and they hang on for the family. And I don't want my children to go through that. They lost their dad when they were 20 and 21. I'm the only parent they have left, and I don't want to be a burden on them. So I have stressed my wishes multiple times. And I often say at my age now, at 69, if something would happen, I would want to give treatment a shot. But if I am 80 plus and I get a stage 4 cancer diagnosis and going to live the last days being sick and ill from treatment and become a burden to my family for the care, I don't want that. Quality of life means more to me than the quantity of life. And I want that to be good for my children and my grandchildren as well. Just a couple things. That number one, there is such a thing as dying well and making your wishes known, and that you do have choices. You are allowed to say no to treatment. You're allowed to say, I've had enough. I don't want to go back to the hospital anymore. I don't want to go to the nursing home. Or you have choices in palliative care, hospice, home health, how you want to live the last of your life. And by letting people know your wishes, you're more apt to allow that to happen. And I've seen some really horrible things happen to families because they haven't had those conversations and they didn't know they had choices, and the patient didn't know they have choices. You always have a choice, and you have a right to say no more.